the way they treated me. This Saskatchewan, they just came there and said, "You're leaving to Ottawa."
66-year-old Ken Roth, a retired fire chief from northern Saskatchewan, is one of 22 intensive care patients who have been moved out of province to Ontario.
I said, "No, you can't do that. My family's here. I can't just go."
The Metis man says his wife and daughter had been visiting him at the Saskatoon hospital every day, but he was moved so quickly he didn't even have time for a phone call to say goodbye. A traumatic reminder, he says, of how he was ripped away from his mother when he was 6 and sent to residential school.
I'm sorry. And just like when I was a kid, they did the same thing. It just hurt me so much.
Another 6 ICU patients will be moved to Ontario by Sunday for a total of 28. The head of the Saskatchewan Health Authority says there's a process to inform patients who are conscious and their families.
Certainly would apologize for the, any pain or suffering for that patient that would not coincide with our current process of having people sent out of province.
The province isn't sure whether it will move more patients next week.
We are seeing a reduction in our COVID patients. We are seeing a reduction in the use of ICU beds.
But if it does, Roth says to be more sensitive, especially to residential school survivors.
Let them at least talk to their family, You just don't grab people. Those people like me, it really brought trauma back to me.
Roth is pleased with the care he's receiving at Ottawa Hospital. His family is driving to Ontario, but most are not fully vaccinated and won't be able to visit him in hospital, a policy Saskatchewan will soon adopt as well. Bonnie Allen, CBC News, Meadow Lake, Saskatchewan.